Hello, and welcome to today's webinar. TPC uses precision benchmarking to supercharge negotiation success and savings. Before we get started, I'd like to go over a few items so you know how to participate in today's event. Everyone will be muted for this presentation, but you can submit your questions at any time by typing them into the questions pane in your control panel. We will address these questions during the Q&A session at the end. In addition, this presentation will be recorded and sent to all participants. Now, I would like to introduce our presenters, Chris Gormley, CEO at MedPricer, and TK Ken, the Director of Purchase Services at TPC. Chris, I'm going to turn this over to you to begin the presentation.
Okay. So thank you, everybody. And first of all, I want to thank TK and the team at TPC for participating today and for their work with their members. So first of all, just a brief introduction to MedPricer. MedPricer has been in the business of purchase services and helping cost savings for the last 12 years. And you can see some statistics. At its core, we help our customers both get savings today, but also build an infrastructure and a team for tomorrow. We help save 21%, an average of 40% faster. And you can see some of the statistics. One of the key things that I want to highlight today is that much of the data that we use to base our precision benchmarking on is based on competitive bidding. And MedPricer is, at its core, a company that has helped our customers, healthcare customers, save money through competitive bidding. And so what you're going to find is the data that we're actually collecting here today is made useful through precision benchmarking. So you can get the best of a competitive bid without necessarily going through it, because we actually have collected this data and we've actually made it available through our precision benchmarks. So with some of these statistics, you can see that we're a cost management company that, again, has been in business for 12 years, and some of the statistics around $3.4 billion of e-negotiated spend. And you can see some of our reference accounts. One of those is Johns Hopkins, which we've been doing business with since 2008. So next slide, please. So here's what we're going to talk about today. Why purchase services, why purchase service benchmarking matters, and how does MedPricer provide this. And then the rest of this is going to be, and I want to focus most of the time on TK and his use and their use of TPC's data in precision benchmarking. And then we're going to have some questions and answers. Next slide, please. So first of all, purchase services. Why is this important? Well, we've seen all these highlights. Hospital systems laying people off, hospital systems cutting services, and this is mainly driven by the next slide, which is around cuts and reimbursement. So this slide was taken from the association, the American Hospital Association, and you can see that private payer, the mix has changed increasingly as people retire. They're moving on to a Medicare, Medicaid mix. Because of that, the break-even point associated with what hospitals can actually make and reimburse money on has changed. And as a result, it's putting operating margin pressure. And with operating margin pressure, there's only really 3 or 4 things you can do. One, you can lower your cost of labor, which is where we see the layoffs. You can cut services, or you can cut your goods expenditure, which is where a lot of the focus has traditionally been, or you can look at your purchase services. And in our vernacular, purchase services are the next slide. And purchase services are those elements that are non-labor, non-goods-based, third-party supplied services. And they include things like linens, valet parking, elevator repair, managed print services, lawyers, insurance, groundskeeping, snow removal, food service. These are some of the items that we have. MedPricer actually has almost 600 different categories that we work in when it comes to purchase services, and the data that we collect and help our customers source are in one of these categories, and these categories are organized into 9 different stakeholder groups. But the salient point here is that this area in purple, on the 24%, is an untapped opportunity for you to realize savings to help your operating margins to basically retain jobs and to retain services. And that's the bottom line. So if we just do the same things we've done in the past, we're going to get how do you get savings, and how do you address this challenge of purchase services? So let's go to the next slide, please. So we'd like to now address a flash poll And Cheryl, if you could please take us through that, and this is going to give some real-time information for those people on the call about what actions have you taken in the past to address purchase services.
Okay, so the poll has now been opened up, and what is your current engagement level? So if everyone could take a few minutes and answer the questions on your screen, probably give you about 15 seconds or so, and then we will close it out. So it looks like almost 70% or so of people have voted. So let's give it another couple of seconds. Okay, get in your last votes, and I'm going to be closing out the poll now. So it looks like 22% have answered no purchase services program in place for the first answer. 33% are actively investigating purchase services program. 11% have a purchase services program with no staff but run by a third party. 11% have a purchase services leader but no supporting team. And then finally, 22% have a purchase services leader and supporting team.
So thank you, Cheryl. So it looks like we have a pretty evenly blended group of people here. Some people that are just starting their journey on purchase services and those that have actually staffed and taken some action already. I think what you're going to find is that precision benchmarking and purchase services, how do you get their performance, is useful for both parties. So what I'd like to do is really narrow focus right now some different actions when it comes to benchmarking. Now, benchmarking is something that everyone looks to help, number one, understand how well you're doing against your peers, both locally, regionally, and nationally. But I'd like to put forward that benchmarking is also useful to gain savings, and that's where our focus is going to be. It's certainly around the relative comparison, but in the end, even if you're about to start or you've been doing this for some time, it's how do you actually action the savings themselves. And so let's go to the next slide. Everyone wants the quote easy button, which is really where we are. And why is that the case? Well, because traditionally, benchmarking has been the guise of goods, right? And with a set of goods, whether it's a syringe, bedpan, or even pharmaceuticals, comparing those to one another is relatively straightforward because you have a part number, you have an identity. And what's different, though, on the next slide, please, is that purchase services are fundamentally different. And they're different because, number one, there is no part number, right? You're dealing with something that is a service. It's generally driven by an SOW, generally driven by a contract, and therefore there's not a defined item for comparison. So how do you actually find and obtain use-based data and price-based comparison data for these intrinsically non-comparable items? How do you judge quality, which is another aspect? Because unlike a part or a good, you don't have a spec in order to compare these two very easily. So therefore, quality is sometimes in the qualitative delivery of those items or are measured differently. And then finally, service costs can vary substantially across a geographic region. So New York City, for example, compared to, let's say, a city that might be more rural, the costs are going to be very different based on the labor inputs. And so as a whole, there is no real easy button here. This is a different animal. And so when you think about how you compare your service from one, let's say, system to another and one hospital to another, you have to consider the nature of the category that you're comparing, let's say a linen service category or maybe a transcription category. You have to consider where it's delivered, and you have to consider the actual service level agreement in the SOW that's part of it. So I just wanted to impress that upon everybody. So what we're going to go through is some different ways that MedPricer has chosen to do this and deliver it to the market. So let's go to the next slide, please. So we have two different types of benchmarks. The first is what we call directional benchmark, which allows you to make rough prioritization and identify what savings are possible. And there's two versions of these. One is based on our competitive results in the past, based on our competitive bidding results. We have an average savings and a range that allows you to quickly, in a sense of, gee, this category is worth more to me than another category based on past bidding results. And we have something we call ratio benchmarking, which allows us to compare your performance based on some numerator-denominator combination. So let's take linens and divide it by the number of beds, for example. That's a driver, if you will, because linens are driven by beds. Or let's look at EVS or something where we're looking at janitorial services, and that might be divided by square footage. And it allows you to then compare on a relative basis against different health systems and different facilities. But what we're going to talk about today is precision benchmarking, which allows you to go to a supplier and actually provide a very convincing argument that they need to provide better terms and better savings. And that's at a level that is almost considered, I always like to think of it as like a house comparison, right? If you're going to try and sell your house or you're going to buy a house, you want a house comp. You want to compare it to other sales that have been made in the neighborhood. You want to compare it to the number of beds or the number of square foot or whether it has a pool or not or a flat backyard, et cetera. And you've got to consider all those details. If you don't, then you're going to miss price and you're not going to get the exact number that you're looking for. And it's also something that really speaks more highly to stakeholders who really know their stuff. So we're going to look at a precision benchmark through TK's example, but that's essentially the way we tend to think of benchmarking, and we're going to talk about precision benchmarking. So let's go to the next slide, please. So I think this is the final slide that MedPricer has. So what is a precision benchmark? Well, first of all, what we do is we collect contracts from our clients. We then use those contracts as the basis of comparison. We'll then take the terms, conditions, and the pricing that's implicit in those contracts, and then we'll look at MedPricer's competitive bidding results. And as a result of these, we get submissions based from each of our suppliers that bid based on RFPs that our customers are asking us to bid. So we have the detailed SOW level, service level agreement data that we use to then compare the prices and the contracts we receive from our clients who are in fact using the precision benchmark. So we can get you to a level that's very precise. And I like to think of it as you could almost get the benefits of competitive bidding without actually doing the competitive bidding, because we're comparing it to past competitive bidding results, which tend to be very aggressive and also very substantial and very good for comparison purposes. So we actually issue a report, and then you can use that report with your stakeholders or with suppliers. So with that, I think I'm going to turn this over to TK, and actually one more final slide. One thing that we consider in these different benchmarks is we consider your contract terms, the labor variance, the service volume and the frequency, the requirements that are unique, and the requirements of the facility and the prevailing market conditions. So these are all the things that we consider in a precision benchmark. So I just want to impress upon you this is much more detailed than a ratio benchmark, and certainly much more detailed than just simply a basic comparison point. So with that, I'm going to turn that over to TPC and TK.
Thank you, Chris, and welcome, everybody. First and foremost, I'd like to thank MedPricer and everybody that's on the line attending this webinar. And as Cheryl and Chris said, if there's any questions, please go ahead and type that in the chat box, and we'll take that after the webinar. Just a little bit about TPC. We are in definition, we are a coalition of 11 health systems that span across 3 states. It's in Texas, Missouri, and Arkansas, and we are actively growing our membership. With over 20 hospital and $1 billion in volume, purchasing volume, we've shown a documented savings of about $180 million since 2010, and that covers 3 areas within TPC, and that's supply chain, purchase services, and revenue cycle. Next slide, please. And I'll talk a little bit about TPC's purchase services team. So we've had extensive contracting experience in purchase services, and it spans almost 20 years. And with that said, on average, we've seen about a 14% savings on the initiatives that we've done in the past, which equates to about $35 million in documented savings. So out of that $180 million from the previous slide, $35 million of that is within purchase services. And some of the key categories that we've focused on or have done in the past from a competitive bid perspective are listed there on this particular slide. One thing that I do want to highlight about TPC is our unique collaborative structure that we have with our membership. We are member-led. Each 11 health system owns TPC, and we work on their behalf. And with that said, all the strategy and all of the reward comes from our members from that perspective. We do the negotiation for them, bring that back onto our member from a governance structure, and they give us or provide us the feedback on which route to go from a strategy or a reward perspective. So from our from our structure and kind of the secret sauce that I want to use is that, you know, TPC is very collaborative in the way we approach any sourcing initiative. Next slide, please. So why precision benchmarking? I think that's kind of the key factor for this webinar. One is it supplements TPC's contracting approach in purchase services. I think in the past and kind of our current structure was that we didn't have insight into exactly from a benchmark perspective of what's going out in the market or from a national perspective. What we did have was from our 11 health systems, hey, this is what our members have from a terms and conditions or from a pricing perspective, and kind of our approach there was really just doing price leveling to make sure that our members were getting the same price and the same terms and conditions. I think one of the key aspects here is on the precision benchmarking with MedPricer is that it provides transparency. And I think that's really a key factor when you really want to understand, are you getting the right price? Are you getting the right terms and conditions? And how do you fare against your peers in another state or in another region or really in kind of your area or your territory? And I think the transparency that's provided from the report gives that, and that's market competitive and insights to terms and conditions. And then I kind of touch upon it from a member-to-member and a national comparison. It's valuable information that you can present to your suppliers that a third party, non-biased, is providing this particular information that you can have that discussions with your supplier during the negotiations stage. So at the end of the day, it's not something that you're telling the supplier that, hey, you know, there's this particular price that I want. This price is out in the market, and they've seen it. And then also, lastly, it kind of streamlines the negotiation process. I think, you know, from my perspective and TPC's perspective, it typically takes us roughly about, on average, about 6 to 12 months to complete a bid, and that's because of kind of the structure that we have here at TPC. But with precision benchmarking, it's streamlined that significantly to reduce it to roughly about 3 to 6 months from a negotiation, getting a bid completed. So those are kind of the reasons why TPC has chosen MedPricer for the precision benchmarking services. Next slide, please. So I think, you know, success is really if we had some case studies to take a look at, and I really chose two right here, and that's on blood services and elevator maintenance services from a purchase services perspective. I know there are other organizations or other companies that define purchase service differently. So with what TPC has done is that blood and elevator kind of fall into that bucket. So we went back to MedPricer and asked, hey, can you run us a precision benchmark on these two services? We provided MedPricer our terms and conditions, our proposal, our spend, all the necessary information so that they can generate the report to provide back to us on exactly how does TPC fare to the market right now, and based on what they've seen in the past from their competitive sourcing initiatives. So what we've seen in blood and kind of a result from the data and kind of the negotiation is that, you know, what our members told us is that for blood services, there really wasn't a national player. It was very, very regionalized or localized that some of the players or some of the suppliers weren't able to service all of TPC members within our locations. So so from that perspective, and then another key result was that turnaround time was very, very key to our members in regards to blood. So with that, our members gave us feedback to say, look, we really want to take a look at this and look at our incumbent supplier that we've been using to see what we can do to enhance our pricing or enhance our terms. And in the event that the value is not there, let's then take a look to see if we can do this from a national play, meaning that maybe we could single source this or dual source it, whatever the case may be. But the strategy was, let's take a look first on how we can really attack this from a local and a regional level and just working with our current incumbent. With a report that was provided back to TPC from MedPricer, we saw that the pricing that our current members had from a proposal perspective, and this is brand new, current pricing, proposal pricing, and what MedPricer has seen in the market, was that it really didn't fare up to what the market was dictating. You know, our prices was a little bit higher, And again, that's due to the complexity of, if the supplier was able to meet the needs, the service, the terms and conditions, and so forth. What that really told us was that, from a pricing perspective, we were an outlier in the market. And then from a terms and conditions perspective, it kind of provided insights to TPC that some of our members were not getting the best terms that was out in the market. So with that said, I provided the information to our current incumbents during our negotiations phase, and as a result, we were able to save roughly about a 4 to 5% saving. That's what the market was dictating, working with our current incumbent. If we were to do this as a national bid, went out and single source this with one particular supplier, and kind of sacrifice on the turnaround time, we might have seen a larger savings perspective, but that wasn't the direction that our members wanted to do. And at the end of the day, we were able to provide increased value back to our members based on the report that MedPricer provided to us to show the transparency that was out in the market. And then another key term, and I think kind of mentioned this, is that it really was a streamlined negotiations process. We did this in 3 terms, meaning we went back and forth with the current incumbent in 3 negotiations, and we were able to get to the best and final proposal from them. And with that said, our members were very happy with the result that was achieved during the negotiation phase for blood sourcing. And then just to touch on elevator maintenance, I think one of the key things here was that we knew from our members' data that there were some members that was an outlier in regards to the pricing that they were paying for the services and then the terms and conditions. What we did know was how did that fare to the market and what was the market dictating. So we requested another precision benchmarking report, and what we found out was it kind of confirmed what we've seen was that out of our 11 health systems, 2 of our members was an outlier in regards to what they were paying for the services and elevator maintenance, and then also the terms and conditions. What that equated to was that we were able to go back and forth with our incumbent, and was able to get on average a 15% savings in the services of elevator maintenance. But what it also showed was that the 2 members that were an outlier saw more than a 15% savings because we were able to reduce the pricing for them or enhance the pricing. And then we were able to take some services that they were currently had as a requirement wasn't the best practice that we've seen through TPC and also through the report that MedPricer provided to us. And, I think at the end of the day, what I really want to kind of hammer on is that it really is just looking at to see how TPC, how our members compared out to the market. And I think, that is very valuable from our perspective because we have to present this back onto our members and showing our members that, hey, this is what the market is dictating, a very easy discussion with our members, and then also an easy discussion with suppliers. And I say easy discussion with the suppliers very loosely because sometimes it can be hard, but I think as long as you have the information that's presented and you present it back to them, it kind of starts that dialogue to say, okay, this is what the market is dictating, this is what we're seeing in this particular region, this is how it compares to a system that has X amount of volume, here's some of the requirements that we're seeing. So next slide, please. And just really just to end it end on a note, I think the key term or the key takeaway that I really want to say here is transparency, transparency, transparency. I think it's really key just to hammer that as long as you know what's out in the market or what the market's dictating from a pricing perspective, from a terms perspective, everything else kind of falls into place. To streamline the negotiations, the dialogue between you and your supplier or potential suppliers in regards to the negotiations perspective. And then you have a documentation that you can take back to your leadership team or your stakeholders to say, this is what we're seeing out in the market. It's from a third party, non-biased, to say this is what they're seeing out in the region as well. So key takeaway is transparency, transparency, transparency. And with that, guys, I think that kind of ends our section. Again, thank you for your participation, TPC, and then kind of turn it back on over to MedPricer for questions and answers.
Thank you, TK. That was a great presentation, and we're now going to begin answering some questions submitted during the presentation. And as a reminder to everyone, you can still submit questions through the questions pane in your control panel. To get started, TK, how did this data help you to gain buy-in from your members?
I think one key thing that I probably left out and kind of probably went over pretty quickly at the end is that, before having precision benchmarking, what we did was we really just looked at kind of price leveling, meaning that we had all of our members' agreements, their terms and conditions, their proposals, and so forth, and we did our own kind of streamline and research of exactly, what member had the best price, what member had the best terms and conditions, and kind of marry that together and really kind of standardize that. I think getting back to your question is that we really didn't have any documentation to take back to our members to say this is what the market was dictating, this is what we're seeing. All that we had was basically what our members had negotiated or what TPC had negotiated in the past, and really just worked on that. And I think with precision benchmarking, it is another documentation or another reference that we provided back to our members with almost every single bit to say, this is what the market's dictating, this is what we're seeing, and it's a very valuable document to have because now it's just not TPC saying that, hey, this is what the market's dictating. This is what, we have a third party saying this is what the market's dictating. And similar to, your competitors like MD Byline, ECRI, or so forth, our members have those particular reports from, for a capital or if we're taking a look at other categories in supply chain and so forth. This report kind of validates what we're seeing in purchase services and kind of what the market's dictating. So it really is another reference or documentation for TPC to take back to our members to say, hey, we're not just telling you this, but this is actually what's out in the market right now.
So what did your suppliers say? How did they react when you reviewed this?
I think, the first reaction was like, no, this is not the pricing that's out in the market. I think what it has shown is that, there's some discommunication within some of the regional offices within the supplier's company or so forth. Some regional office might not talk to each other. Their local reps might be rogue reps that might be, providing prices at different price points and so forth. I think this really shows to say, hey, this is what we're seeing out in the market. Whether it's you or your competitor that's providing this particular price point, this price point's out there. And this is a reference that we're providing back to you. And it's really, to me, and just for TPC as an organization, has really provided an open dialogue with our potential and our current incumbents to say, this is what we're seeing. Provide us back what you're seeing out in your company and what you're providing, because sometimes there is discommunications between different territories and within the supplier's company.
And Cheryl, if I and TK, sorry, if I may, on the price point, and back to TK's point, what we're doing is the source of this data is actually competitive bidding events that have occurred throughout the country, number one, and also regionally. So back to the point of, we see in a lot of different purchase services that many times you'll see, like I think a good example is managed print services. You might see one of the local or one of the national brands, you might have the regional office bidding, and that regional office is going to have a different sort of approach to it than, let's say, another regional office. So ultimately, when looking at this, we're trying to bring maybe more data than any local rep would have, and it gives you that sort of power to actually have a comparison. Because I'd like to think, and we'd have to let Gardner or some other groups say this, but ultimately I think we have the largest competitive bidding results of any organization in healthcare today. I mean, when you look at it from an online competitive bidding event specifically, there's quite a bit of data that we've amassed in each category, and that's what we're trying to bring forward through these compare reports or these precision benchmarking reports for folks like TK.
Well, thank you, Chris and TK. We are right at the end of the half hour at 11:30, and so we do have several other questions that came in, but what we'll do is we'll answer those questions, and we will email those out to everyone, and we will also send up a follow-up email with a link to view the recording of today's webinar. So thank you, everyone, for attending, and have a great day.
Thank you, guys. Have a great day.
Thank you.